Hi, this is Dr. Mamta Dighe, Director, Xenith Advanced Fertility Center, Pune. We are based in two locations, Wakad as well as Koregaon Park. It is our constant endeavor to bring information for our patients as well as the general public in order to throw some light onto the increasing menace of infertility which is occurring globally. Today I am going to be speaking on secondary infertility. So what is secondary infertility? When a woman is unable to conceive or carry a pregnancy to term after previously having conceived and especially delivered a full-term baby, then it is termed as secondary infertility. The previous pregnancy should have happened without the use of any fertility treatment, especially any assisted reproductive treatments. How common is secondary infertility? Frankly, secondary infertility is as common as primary infertility and many couples face this problem. Unfortunately, it is a problem that is not addressed as well as primary infertility, and sometimes couples are even told to ignore the problem and just be thankful for the one child that they already have. I have especially seen after the COVID pandemic, couples wanting to have a sibling for the child that they have, knowing the importance of having people around you and the importance of family and having an increased desire to extend their family. It is something that should not be ignored and should be addressed equally by the couples as well as their treating physicians. What are the causes of secondary infertility? Secondary infertility, like primary infertility, has its causes based both in the male as well as the female partner. In females, the common causes are decreasing ovarian reserve because of increasing age, problems with the tubes, especially if there has been a previous difficult labor or a cesarean, which could hamper and cause problems with the fallopian tubes in the woman. It could be increased weight, lifestyle problems, issues with the uterus such as post-cesarean, there is some scarring, there is a problem with the endometrium, and some other hormonal issues related to weight gain. There are of course other problems as well, but that will have to be addressed when a complete history and evaluation of the couple is done. As regards the male, the common causes of secondary infertility are decline in the sperm counts and motility, probably with increasing age, stress, hormonal issues, varicocele, which is a condition related to engorged blood vessels around the testes, lifestyle factors, weight gain, and many other issues which again need to be thoroughly evaluated. So what should be done if there is a problem of secondary infertility if a couple is facing? I think the most important thing is talking to each other and taking a decision to address the problem. Time is of essence over here because of the increased age of the couple, since it is a secondary infertility, and also because of the problems that may arise related to the decrease in the ovarian reserve in the woman. Hence, it is important to see your reproductive endocrinologist or fertility specialist at the earliest and at least get an understanding regarding where you stand and what is the problem. So if you have been trying for your second baby and have not been able to conceive over the last 6 months to a year, it is time to go and seek a consultation with your fertility specialist. What kind of treatments are available for secondary infertility? Like in primary infertility, again, the treatment will be related to the cause of infertility that is diagnosed. So depending upon the ovarian factor or the tubal factor or the male infertility factor, treatment will have to be addressed accordingly. The most common used treatments are either ovulation, helping ovulation and giving a timed intercourse for the couple, doing an intrauterine insemination, correcting the issues or the causes of infertility that may be associated with the couple, especially blocked tubes or unhealthy tubes that may arise commonly in secondary infertility, and treating low sperm counts as well as motility in the male. At times, even in vitro fertilization and assisted reproductive treatment may be necessary in the couples in order to give the baby. It is important to understand what the problem is and what has changed since the first pregnancy in order to expedite the process and the time to having the second baby and a sibling for the child. It is important to address this issue and make sure that time is not lost in the need and in the desire for having the baby. If you have any questions regarding secondary infertility, please feel free to write to us on the email info@Xenith.clinic. Also, please do follow us on YouTube, Twitter, Facebook and Instagram, and send in your queries so that we will be able to address it. Thank you.